Hello everyone, welcome to this recorded session focusing on the Midlands Children and Young People's Mental Health Optimisation project. This project was commenced in March 2020 but was sensibly paused during the COVID pandemic, and now we're looking at how we can sensibly restart that. My name's Sarah Wright and I'm an Improvement Advisor with the Mental Health System Improvement Team. Right, just to introduce what we're going to talk about within this session, we're going to think a bit about the refreshed goals and the links with restoration and recovery. Obviously we're in a very different world right now, and we recognise very much that there's a different position across the whole of the Midlands. So this is very much a soft start, but we know that there's some areas who are feeling positive about working on with the maturity tool at the moment, so we don't want to restrict those opportunities, but we'll try and make those connections within this session. I'm going to give you a general overview of the whole Children and Young People's Mental Health System Maturity Tool, describe the domains, elements and CLOEs, and consider the 9 elements that are seen as foundation elements to consider first. I'm going to talk to you about future webinars for the Mental Health System Improvement Team and some of the wider support offer that's available at the moment. And I'm going to think about improvement action planning that results from the use of the maturity tool and how again that supports with restoration and recovery and next steps. Now, I've mentioned this already in the introduction, but I really want to reiterate that we recognise that there is a different position around responding to the pandemic across the Midlands, and this offer at this point is optional. It is very much aimed at being supportive, and we're responding really to the fact that we know in some STPs, in some areas, they are thinking that starting to work on optimisation feels valuable. It feels valuable because we know that at the moment there's less children coming into our children and young people's mental health systems than we'd expect. We do expect there to be an increase, a surge in demand. I would imagine this will likely be around September as the schools reopen, so it feels timely to start to think about the position of how our services are set up. The CYP System Maturity Tool remains a useful tool to think about. This has been acknowledged by the National Policy Team, who've shared the detail of this with Chief Execs in mental health trusts across the country. We're also recognising that a lot of the core areas for optimisation within this tool remain valid, with or without COVID. One of the differences, though, is that we can see that there's been a real acceleration around digital developments and the digital offer for children and young people. And we recognise in the Mental Health System Improvement Team that we need to really update that in the tool to reflect that. And we also want to learn from what you've done. I've been away for 3 months in an incident room where I've seen some of these developments, and again, I want to make sure that we really embed that within the tool. And lastly, part of the agreement around this project was getting to the place of a heat map of improvement need across the Midlands, and that still feels like a really valuable thing to do. That's so we can make sure that the national team, regional teams, mental health system improvement team, that we can bespoke our offer to make sure that it meets your needs across the Midlands. Now I just want to talk through the system maturity domains and just do a bit of a refresher on this, and I'm going to connect some of this as well to the restoration and recovery work. So the first domain is around strategy and sustainability. I really want to recognise that one of the areas we often see in diagnostics that causes inefficiencies and results in services not being optimised is the lack of joining up of services and vision. And this means that referrals often go to multiple places, children are offered support in a range of ways, and there isn't that coordination. So strategy and sustainability remains really critical. This feeds into your model. We often talk about Thrive, but there's other models, certainly in Coventry and Warwickshire, which is in this area, have done an excellent job of creating a model with young people. So it is thinking about, though, what's that coherent vision, that coherent model that really makes sense of how you're delivering services. Often when we think about access and weights, we end up coming back to the need of a real clear access policy. And I'm going to talk a bit more later on about some of the support offer. But that access policy should really make sure that everyone understands where they fit within the position of delivering services. That also impacts on your activity, because if we all understand what our role is within the system, then we can all be clear about what we deliver. Thinking about practice based on best available evidence, I think that this again is going to become increasingly critical when we think about the needs of children maybe who are more socially anxious because of the COVID pandemic, that they've not been out as much, they've not been to school, and really thinking through, do we want those children to go to therapy, or is there an approach that's more normalising? What would be the best way to respond to those children's needs in a way that's appropriate? this result, whatever evidence-based practice you deliver, you need a workforce suitably skilled to deliver it. Thinking about involvement and participation, I've already heard some good examples in the last couple of weeks since I've come back from my redeployment about the ways that children can be involved in a more digital offer and how they can be involved in that. And that would be a really interesting area to think about. Around productivity, again, we're going to talk a bit more about that in some of the support offer, but we know there's been a lot of discussion around surge. One of the challenges in thinking about your productivity is you really need to have a grip on what your capacity is now to understand how you can flex that capacity to meet increased demand. So a lot of the guidance and the elements that are within the tool still remain really valid. Thinking about outcomes, now these were difficult to manage and to effectively use prior to COVID pandemic, and I can't imagine that's going to be any easier now, but obviously monitoring the outcomes of children and young people using services remains really valuable. I've already mentioned about there's an element which we focused on which is more about flowing data, but now we need to think a bit more about that digital offer, and we will pick that up as we develop the tool. And the last bit's really about the culture. So this is thinking about how we support children and young people. One of the things that from my redeployment that I found really quite interesting was the mutual aid support between provider trusts and how effective that was, and that system thinking that we don't always see when we do visits, and which has really been highlighted as a strength post-pandemic, and we really need to harness that. And again, I'd argue that's something we can think about when thinking about children and young people's services and systems. But I'm just going to now give you this refresher about the way that the maturity tool is structured. So those of you that watched the videos before will remember this. I'm not going to do this in a lot of detail because you'll see about 2/3 of the way down that slide there's a link to a YouTube video. Do a 30-minute video which describes in detail how to use the tool. So this is just a refresher saying you've seen those 10 domains. Under the 10 domains there's 61 different elements that cover the particular needs related, what elements collectively would help you achieve that domain goal. And under each element there's CLOEs, these key lines of inquiry to help you start to think about what questions you need to ask yourself, and this really are written in a way that we hope really supports thinking of improvement ideas. And then there's self-rating, which can be reviewed at a different point in the future. Like I said, there's a video. If you want to, really would advise that goes into detail of how to use the tool. Hopefully don't talk for too long on there, but it's about 28 minutes, 30 minutes. So now I'm going to just talk about, there are 9 elements in bold that are shown within the System Maturity Tool that we think are real foundations. So I'm going to talk a bit more about those next. Right, so these are those 9 elements that we think are really foundations, real critical to having your system set up to be able to work in an optimised way. Now, 5 of those are within strategy and sustainability, and apart from the local transformation plan and that sort of clarity of your vision, the rest are really related to more governance, knowing that you've got a clear governance structure in there, that you've got an STP way of monitoring what's happening operationally, and that you've got the right leaders in there to create that urgency for improvement and to create that ownership, and the clinical leads as well. So that's really a strategy section. The next section is around access and weights, and this again couldn't be more critical now when thinking about a potential increase in referral demand. So it's thinking about how is your activity distributed between the services within your system. Thinking about an access policy and how can you make sure that everyone gets to the right place the first time so that you really optimise the offer. And a route as well for thinking about when things don't go well, what happens if you've got a challenge, something that doesn't happen. Now, one of the things that we really recognise when doing diagnostics is when we speak to services and they'll say this is the first time we've sat in a room together during this diagnostic, and then those services come up with the results and come up with the ideas. So it really is key to make sure you've got those opportunities for people to come together and to have a think about the challenges in your SCP, in your locality, because no doubt they'll be the ones who are most likely to have the answers. And the last one is thinking about productivity. Now, we sometimes see KPIs. We've seen over 100 KPIs in some provider trust that we visited. And I understand that for commissioners it's really key to want to feel like you keep a grip, but we are within this promoting a smaller number of critical KPIs, and we would argue that particularly when you're thinking about optimising services, when you have a lot of KPIs, although it might help feeling that there's more grip, it puts an inordinate pressure on those providers to deliver that data. This is often not an easy thing to pull out. So we talk about in here thinking about access, waiting times and clinical outcomes. So that's particularly thinking about the overall contribution of each service to the access standard. Thinking about waits for treatment, and that including subsequent internal waits. Thinking about the length of episode. That's a really critical factor in understanding how your services are optimised. Are people staying for 30 sessions or for 8? This is how you can create capacity. Looking at the number of sessions on discharge, so that's seeing that keeping an eye on that position and the discharge numbers. And also thinking about clinical activity. You'll see within the System Maturity Tool, there's a slide that talks about some of the headlines around productivity. And the one that we all struggle with, and I've delivered CAM services as a clinician, and still always surprised by this, it says there's less than 2 contacts per day is the benchmarking position. There's got to be some opportunity, particularly with digital, to make sure that that number's improved so that we're able to provide services to more children and young people. Now, like I said on the last slide, the top 5 of those 9 critical factors are all within the strategy. They all talk about governance, really. So this slide really just proposes a structure. It doesn't have to be this structure, but it just proposes a system-wide structure where there's a steering group, a clinical reference group being that sort of overarching, having that helicopter view over the services, monitoring some of the quality, looking at opportunities for pathways to work across the system. And then having another tier which is focusing on those key areas of system pathways, so really thinking about the clinical offer, the evidence-based pathway, and the journey of children and young people through our systems. Thinking about workforce and thinking about data and IT systems. Now, in a structure like this, we think that a lot of the questions in the Children and Young People System Maturity Tool will be answered within those 5 groups. There'll be some of the bits that will be outside of that, but a lot of that we think can be answered by that. So although this is absolutely an example, it's just we're really asking you to have a think about what is your governance structure so that you feel comfortable that you've got a route to drive improvement and optimisation. So next I just wanted to talk about some of the support that we're hoping, that will be available to support the delivery of the optimisation project, and that is being delivered generally from the Mental Health System Improvement Team and the Improvement Directorate to try and help with recovery and restoration. So we're currently working with the wider Improvement Directorate to develop tools, webinars and a support offer. This work was generated really from the themes and the work completed with the 4-week wait Children and Young People site. So I think the Children and Young People services should really be positive about their contribution to this, but we've been asked now to not only think about this for Children and Young People services, but also to think about that, how this can be used for wider mental health services. But that is key, I think, to thinking about how we can take forward some of your learning from completing the CYP System Maturity Tool. There's an opportunity then that you'll get some improvement tools, some webinars, some support, some active support. I'm going to talk a bit about that on the next slide that hopefully will be useful to you. So I'm going to think a bit about pathway mapping, and at the moment we're preparing some tools that will hopefully make that easier. Thinking about capacity and demand review, and some of you will know about the CREST tool, and that's really been progressed quite a bit just prior to COVID, but certainly is acknowledged now as being a useful capacity and demand modelling tool, so we'll talk a bit about that. We're doing some work to think about developing access policies. This will include having a draft version, a standard that you can then put in your own information, some checklists around that, and we're working on that at the moment, and that will hopefully be ready in 6 to 8 weeks. Thinking about effectively managing caseload, how can you do that so that you manage wait times, you manage discharge rates, so again that will be coming forward. And we're doing some work on waiting list management strategies, particularly around PTL, thinking about sustainable waiting list sizes, and this is really some of the learning from cancer and elective care, and we want to make sure that that's readily available to you within mental health systems. So like I said, these are being developed for the whole mental health system, but I think we're going to make sure that we personalise those for children and young people services through some of this optimisation project. Now, I also wanted to propose some other support from the mental health system improvement team, particularly probably from myself, but there are other colleagues across the country. There's only 6 of us in the team, but we've been used to travelling around the country all the time, coming visiting all of you. And obviously now we're all on teams, we're all working a bit differently. I wanted to put out an offer to also to work with you a bit differently. So thinking about coaching, if there's anyone would like some individual coaching or you'd like some group coaching, thinking about CYP mental health improvement work. If you wanted me to join any sessions remotely to facilitate group sessions, thinking about those domains, I'd be very happy to do that. Could also join discussions just to clarify or discuss improvement ideas. Now, I'm not as au fait with some of the detail of the mental health system improvement team, but I have cleared this with colleagues who equally would be happy to come and join some sessions if that would be useful. And reviewing any documents to support the any development ideas. If you want to send me anything to have a look at, I'd be very happy to work with you on that, or just to generally just have a discussion about areas of challenge and consider good practice nationally. Certainly for the next 6 weeks, where we're expecting still to be working very much by home, this has created quite a lot of extra capacity for us within the team as we've changed our way of working. So we're making sure we can develop to be hopefully be as useful as we can. Now, I'm just wanted to show you this quickly, just so you can see some of the sort of sessions that we're used to supporting with, but also some of the change way that we're thinking of working. So we would normally go out and do a visit for a couple of days if we're doing a diagnostic visit. We're now offering a range of Teams calls and doing those with these sort of themes. Now, any of these individually, we're not going to come out except with the agreement of the region to do a full diagnostic, but if you want 1 or 2 of these sessions provided within your STP, these are just some of the headings, so I thought it was useful to share that. So we're sort of coming to a conclusion now in this session, so I just wanted to again reiterate what we're hoping to achieve. We do believe that reviewing your system using the CYP Mental Health Maturity Tool will deliver improvement ideas. We've had feedback already. We've had one area down south who's already completed the tool, ready for a review, and have noted that in a post-COVID world they still found that really helpful. Interestingly, what they did is they didn't do that as a full system, which is what we proposed. They actually, the commissioner, a third sector provider and the main provider all completed the tool separately, but they've all still got improvement ideas from that they're able to pull together. We also would advise looking at those 9 elements first, thinking about your access and weights and productivity, and that then we've got that opportunity to really start to develop that further. And if we've got things that we like access policy drafts or good practice examples that are useful to share, we absolutely will start getting that out through this route. And we believe that optimising services to ensure all that capacity that you've got is available to support increased demand is still a really improvement and valuable activity, although, as I've said a couple of times already, we absolutely understand and respect that that may be at different times across the Midlands that we take this work forward. Right, so I'm just going to conclude now by telling you what I've told you really. The next slide gives all of my contact details and my emails. Please don't be shy about getting in touch with me. I'd love to hear from you if there's anything you think's helpful, and also to hear about any feedback on the maturity tool. This is the first time we've set out the support offer in this way, and it is very much driven by my background as an operational manager and thinking, gosh, I wish someone had given me this sort of list that I'd gained from doing the visits, that privileged position that I feel I'm in now, being able to visit lots of children and young people's mental health services, and you start to collect things and think, gosh, if I'd have known that. And that's really why we set this up. That was very much the motivation. So I've told you about the tool. If there's things you want to talk to me about related to that, I'd love to hear from you. I've described the domains elements, Chloe's, those 9 key foundation elements. I've talked to you about support sessions and just a general support offer from myself and from the mental health system improvement team, about thinking about developing those action plans and how that links to restoration and recovery. So thank you all so much for listening to this, and I hope you get in touch soon.